At some point in your life, you're going to be cut by a knife. Some of us will be cut more than others. But there's always a cost when you get a cut, both physically and financially. In this video, we're going to discuss the financial cost of getting cut by a knife and why it's so darn expensive. So just how much does it cost when your finger gets nicked? Let's go inside and find out. Welcome back to Blade Insider, where we discuss all things knives. We're going off the reservation in this episode to discuss healthcare costs related to cutting yourself with a knife. As you will see in this video, when I said we discuss all things knives, I wasn't kidding. Any close observer to this channel has figured out by now that one or more of my fingers usually has a bandage on it. Anytime you're handling knives, you're apt to nick one of your fingers with the blade. I'm sure there are those of you out there that are probably a little more careful than I am. Today, we're going to discuss one of those incidents and the consequences of seeking medical care. After watching this video, I hope you're left with a better understanding of just how expensive routine medical care can be, and maybe you can help change that. I want to hear from you about this topic. Are you afraid to seek medical help because it might bankrupt you? Does your health insurance cover your costs when you go in for medical treatment? Do you think the medical field has been left unchecked and can charge you whatever it wants for whatever type of procedure you need? Good, bad, or indifferent, let me hear from you in the comment section below. And please, hit the like button if you enjoy the video. Don't forget to subscribe to our channel for new weekly content. One night, several months ago, I decided to help out around the house and wash dishes. This was probably 8:30 at night on a Sunday. We have a nice set of kitchen knives, and I didn't want to put them in the dishwasher because at some point they're going to rust. So I began to hand wash them before putting them away. As I was washing one of the steak knives, I accidentally cut my index finger. It was one of those cuts that may have been deep enough to require stitches. Frankly, some of those cuts, you just really can't tell whether or not you need stitches unless you have a medical professional look at it. So I wrapped it up in a paper towel and I went off to our local ER. I had to go to the ER because my doctor's office was naturally closed and there were no local urgent care centers that were open that late at night. I arrived at the ER about 9 p.m. that night. They took me back into an examination room where the doctor came in to examine me. The laceration was approximately 3/4 of an inch long. The cut wasn't deep, but rather it went horizontal into the skin. The cut itself had already closed and did not separate as the doctor examined it. The doctor determined that I would not need any stitches. The treatment plan included soaking my finger in warm soapy water for approximately 5 minutes, then an application of a super glue-like material to the cut. The finger would be bandaged and I was to be given a tetanus shot. The only actual contact I had with the ER doctor was during the initial unwrapping of the finger so he could determine whether or not I needed stitches, and when he applied the super glue material to the laceration. The doctor was very nice, but there really wasn't any medical skill involved in the application of the super glue. In fact, he kind of just opened up the package and globbed the glue onto my finger. Total time spent in the ER was about 1 hour, and the total time the ER doctor spent with me was about 5 to 10 minutes. So, given the lay of the land and knowing what treatment I received, what do you think the final bill should have totaled? Now, granted, I went to the ER and there's always a surcharge when you go to the ER. But what do you think? How much should that ER visit have costed? $500? $1,000? $2,000? Let's go to the bench and take a closer look at the bills. If you guessed at any of the previously stated amounts, you were wrong. I was actually sent two bills, one from the emergency room and the other from the emergency room doctor. The emergency room totaled $2,234, where the ER doctor charged me another $917 for a total of $3,151. This was for less than an hour of time with no stitches. I was absolutely floored by these two bills. Now, let's take a closer look at the bills and see what they charged me. The ER charged me an $800 general facility fee. Importantly, these fees vary from hospital to hospital. $800 is on the high side for this general facility fee. These facility charges are supposed to be what it costs the hospital to maintain the ER services, but they do not have to be disclosed to the public. For example, you may have 3 or 4 hospitals located within driving distance. An astute consumer would pick the ER with the lowest facility fee, but since they're not public, you have no idea what this charge would be from hospital to hospital. Furthermore, these healthcare providers handcuff you by the type of medical insurance you have. You may be required to use in-network hospital, and that in-network hospital may overcharge you this facility fee. The next charge is $117 for medical and surgical supplies. This would account for the soapy water, the Dermabond, glue, and bandages. This Dermabond can be purchased for $18.95. Let's be generous and say that the bandages and soapy water brought the total up to $30. This would be a markup of 390%. The next charge was $897 for operating room services. I remind you that I never left the examination room and I never had any services which could be classified as requiring an operating room. I'm being charged almost $900 for something I never got and never required. The next charge was for $264 for the pharmacy charge. I did receive a tetanus shot, and these tetanus shots can be purchased for $48 at any Kroger or Costco. This is a markup of 550%. Finally, I was charged $156 for preventative care services. This essentially is the medical staff saying, be careful with knives and don't cut yourself again. I received a bill from the ER doctor for $917. I saw the ER doctor for approximately 5 to 10 minutes. He didn't perform any medical procedure on me that required more than a rudimentary knowledge of tearing open a package and spreading some glue on my laceration. For 10 minutes of the doctor's time, this charge works out to be $5,682 an hour. That's quite a bit more than the minimum wage. So the bottom line is the bill totaled $3,151. I paid a copay of $250. Insurance paid $2,180, which leaves a balance of $720. So what do you think? Is $3,151 a fair price to pay for a cut finger that required no stitches? 9 out of 10 people would disagree with that charge, and the lone holdout would either be a hospital administrator, healthcare lobbyist, or politician paid by the healthcare lobby. The bottom line is that medical providers can charge whatever they want, and they don't have to tell you what these charges are until you get the final bill. Medical treatment and health insurance costs have gotten out of hand. They've been out of hand for a while now, and I think people are either numb to it or shell-shocked by it. We pay thousands and thousands of dollars per year for health insurance that pays less and less of our health care costs. Health insurance is like the Girl Scout cookies. Every year, the price goes up and you get less and less cookies in the box. People have become afraid to seek out medical treatment. They believe that if they go to the hospital, they'll end up in bankruptcy court. You shouldn't have to work all your life, pay your bills, and have health insurance only to end up in bankruptcy court because of some unforeseen medical issue. I think everyone will agree that paying $3,151 for some super glue and a Band-Aid is just plain wrong. When you see something that's just plain wrong, we should be able to stop it and correct it. Simple, right? Wrong. I'll let you in on a little secret that these lobbyists and big law firms use. Whenever their client, whether it's agrochemical, petrochemical, or tobacco, wants to do something that's just plain wrong, they will argue that the solution isn't simple. They will say it's a complex problem that needs to be studied. All they really want to do is delay any action to correct the problem until people become numb to it again. So what's the solution? I don't know, but it's not with our politicians and not with our government. The Republicans favor healthcare corporations and insurance companies. The Democrats want to give free health care to all those without jobs or those who can't afford health insurance. But who's looking after the middle class, who wake up every day and go to work? Who's looking after those who pay through the nose for health care and health insurance? The answer is no one, not the Republicans and not the Democrats. So what do you think? What is the solution to these outrageous medical bills? Do you want to stop handling knives altogether? Do you want to avoid all risk and live your life in a bubble? Use the comment section below and tell me what your thoughts are. I hope you like this video, and I hope you think about this issue during our next election. Don't forget to subscribe to this channel for new weekly content, and hit the like button. I'll see you next week.